Hi physios, so today I'm going to tell you 3 clinical reasoning mistakes that every physio student makes or an early clinician makes and how to correct them. So let's start with mistake number 1. Now this is the most common mistake that we all make, which is treating the area of the pain rather than the source of the pain. For example, if a person comes to you and tells you that they have pain in the knee, we directly jump onto the conclusion that okay, knee is the problem, so we're going to start treating and assessing the knee. But we always forget to ask the question like, what if it's not the knee? What if the pain is getting referred into the knee and the pain is actually starting from somewhere else? So for example, the pain might be starting from the hip, or maybe the pain might be starting from the ankle. We don't know. We'll only come to know when we assess that. So it's very important to ask the question that why is the pain coming from this structure? What is it that is driving this pain into this structure? So then you'll able to actually assess much better rather than just focusing on one area. Always remember that you have to assess the joints above and below the area that the patient is showing the pain. Mistake number 2, that is accepting the referral diagnosis. Now we all have been there, we all have done this in the initial stages of our career, where a person comes in with a referral letter. For example, a person walks in and says that in the letter that they have a problem with the rotator cuff. But what if the problem is coming from the cervical spine? Or what if the problem is coming from some other structure in the shoulder? But we all go lazy and we do okay, the referral letter says rotator cuff, so let's just start treating rotator cuff, which is a lazy assessing and a lazy diagnosis. Remember that referral diagnosis is a starting point, it's not a conclusion. So the mistake number 3. Mistake number 3 is stopping as soon as you find something positive. So we go ahead and we stop our reasoning completely. So for example, you got a positive Hawkins-Kennedy test. Great, you got it positive. But why do you want to stop there? You should always ask questions, even if you get something positive, is why is it exactly positive? What is this finding telling me more about this condition? Remember, a good clinician always keeps assessing in every session. You do not give a conclusion, you have to give a hypothesis when you assess. So it opens up more space for you to assess